Hello, my name is Mike Neely, Principal and Managing Partner for Perimeter Solutions Group and past President of AHRMM. I'm here today to introduce you to a new AHRMM webinar, Shared Risk Contracting, Provider and Supplier Perspectives. We have assembled a strong panel to present this topic to you. And while fairly well known in industry, it's only recently risen as a potential topic in healthcare. While there is no universal definition of risk sharing, for our purposes, risk sharing contracts refer to non-traditional methods of distributing value and a transactional method between parties of the contract. With risk sharing contracts, clinical, operational, and/or economic outcomes are measured and agreed upon prior to signing the contract, and payment is depending on meeting the agreed upon measures. When an organization is faced with investing in an expensive new medical technology or process, before it is universally accepted or proven to be effective, the risk-sharing contract has the potential to lessen the financial risk to the provider, provided there are clear measurable outcomes promoted by the supplier of the new technology or process. The organization can work with the supplier to establish criteria to lessen or eliminate the financial risk should the technology or process outcomes not be realized. A risk-sharing agreement between a provider and a supplier can establish the partnership framework to allow education and data sharing to reach the desired clinical and economic goals. The partnership can benefit both parties, allowing the organization to attain increased quality and the supplier to gather important clinical data in support of their product. I believe we owe it to ourselves and to the institutions that we work for, to constantly be exploring new ways to lower expenses and/or increase revenue, both on existing products and processes, as well as the adoption of new technology. This webinar very much supports the CQO movement and dictates that we should concentrate on lowering costs while supporting and improving quality patient care and achieving the best possible outcomes both for our patients and for our institutions. And while it is very much an overused phrase, do more with less, is definitely becoming a very essential part of every supply chain department and is something that we must constantly be aware of. And with the increasing focus on cost management, healthcare organizations are often reluctant to become early adopters of new technology that comes with increased price, but often as well with little evidence of promised value. Should an institution wait to adopt new technology until it is proven to deliver financial or clinical outcomes claimed by its supplier? I don't think so. And I think this webinar very much will give you the tools, and we will as well provide the background through case studies and basic principles to allow you to evaluate this concept and determine if it has potential for your institution. And while this concept is not for everyone, we believe that if implemented properly and you pay attention to the tools that we will provide you, that it very much will give you an opportunity to implement the CQO movement within your hospital. Thank you, and I hope to be speaking to you along with Terry Corner, Vice President Supply Chain, Lightbridge Health, and Laura Latham, VP Systems of Stryker, in March when we do the webinar officially for the AHRMM folks.